Time now, 7:20. You're listening to Ottawa Morning on CBC Radio 191.5 in Ottawa-Gatineau. The inability to focus in class, hyperactivity, distracted all the time. Those are some of the symptoms associated with ADHD, but are children being diagnosed with it and other behavioral conditions too frequently? The American Academy of Neurology thinks so. Last week it warned that too many kids are being diagnosed, number one, and two, they're being prescribed drugs when they don't necessarily need them. Well, Joel Westheimer has a take on this. He's our Ottawa Morning Education columnist, and he's been hearing from parents and teachers alike.
This is a really big issue right now, and I hear from parents and teachers all the time with huge concerns over the fact that we are medicalizing every childhood problem. Now, at some point, we have to start asking the question, what in our society is creating a structure or a system where so many people feel the need to take medication, and in schools it's even more so, right? So what's going on in our schools that in some schools a majority of children are designated as not normal? And let me repeat that, right? What does it mean when a majority of children are designated as not normal? What's normal, and who gets to decide what normal is? Now, I also want to be clear, Robyn, that I'm not a doctor and I'm not a psychiatrist. These conditions do exist, and the medications are miracle drugs for some kids. But what's also clear is that from research, and it's well established, that the rates of diagnosis have skyrocketed, and they've done so at the same time that our school curricula have become much more structured and lacking flexibility for teachers to tailor the education to particular children.
And just to be clear, which conditions are we talking about? We mentioned ADHD, but what else? So
what's going to resonate with most parents out there is ADHD, right? Half of your listeners are going to say, oh, yes, I had a recommendation that my child be put on these drugs. I would never tell someone, no, just don't put your kid on it. Some kids benefit from it. But what's more so is even if we decide that the normal variation in childhood behavior is what's responsible here, so some kids need to run around, and that we wouldn't want to medicalize that. The problem here is, when you asked about the structure, is that we're so focused on getting kids to focus, right? That's our thing. How come this kid doesn't focus? How come this kid needs to tap his leg or run around or move? That everything is about tailoring these drugs and all kinds of other things to the individual child. But how about, why don't we give them something more interesting to focus on, right? Maybe the reason that some kids aren't focusing is that the curriculum right now is not interesting enough.
So who is calling for this diagnosis? Is it parents that are wanting their children to be psychoanalyzed, or is it teachers that are calling for this?
Well, that's a great question, because there's a number of kind of opposing forces going on. First of all, there are some teachers who say, well, I do have to do this, this test prep, and I do need to keep the kids in chairs without moving for 4 hours straight. And so some teachers say, it would make my life a lot easier if Johnny, my thorn in my side student, were sedated. And they, not in those words, of course, I'm exaggerating, but hey, it's easier to have a group of kids who are a little more attentive than not attentive. At the same time, most teachers are very troubled by this overdiagnosis. Now, parents, it used to be, when you and I were kids, we can all remember that it was the death knell if you were labeled special ed, right? Yeah. Parents fought tooth and nail, especially privileged parents, to keep their kids out of the disabled category, because once you were put in there, you never came out, right? Now it's flipped. Because we've come around in a good way to trying to offer kids who need help the resources they need. Now there's a lot of parents who fight and organize to get their kids labeled so that their kid gets extra help, and sometimes that's very good. The problem is we create a class distinction because wealthier parents can advocate better for their kids to get these labels. They allow extra computers and extra help and extra time on tests. What child would not benefit from these things, right? So there is a growing disparity between the kinds of parents who know how to work the system that way and the ones who don't.
So what is the solution? Because I can also hear some parents who genuinely do have kids with ADHD and say, okay, but I don't want my kid to be caught up in this kind of crying wolf, if you will. Not that they're crying wolf, but having all these kids diagnosed with things, but saying, actually, my kid genuinely does have this. But, how do you not go about it so that you're painting all these kids with the same brush?
Right. It's a dilemma. And first of all, you said, parents might say, well, my kid does have this. And it's important for parents and educators to understand that they're actually, scientifically, there is no this. The DSM-4, and in May of 2013, they'll come out with the DSM-5. That's the Diagnostic and Statistical Manual that's published by the American Psychological Association that's used worldwide. When they're describing behavioral and conduct disorders, they're describing sets of symptoms that if there's enough of them together and there's a checklist for enough of these and there's a pattern, they say the kid has ADHD, right? It's not like we can take a scan of their brain and say this kid has ADHD and this kid doesn't. So first of all, there's no this, right? Second of all, the relationship between a kid having a problem focusing, for example, and the environment that they're in is a one that has back and forth, right? That same kid in a different environment might function quite well. The problem for parents, the dilemma they focus is, unless they're going to pull the kid out and put them in a different school or a private school or some different kind of environment, that's the only environment they have. And I want to bring up one other thing. It's not just ADHD we're talking about. There are whole categories of conduct disorders. One of my favorites is ODD. Do you know what that stands for?
No. Obsessive.
Yeah, it could be
something.
Obsessive. We've all heard of OCD, but ODD is oppositional defiance disorder.
Oh.
Now, if that doesn't sound Orwellian, right?
No kidding.
But oppositional defiance disorder is described as a pattern of behavior where kids are negative or defy authority or talk back to adults, right? Now, again, I'm not a medical doctor. I have seen videotapes of kids who clearly have some kind of oppositional problem, but they are very few and far between. And the diagnosis rate for ODD has gone so high in some schools in urban centers to 20%, I mean 1 in 5 kids, that we all should be raising alarm bells. And we're in a period where we really ought to be more concerned about the degree of diagnosis of these things. And also, we all know who's getting these diagnoses. It tends to be more boys,
right?
And it tends to be more boys and girls of color in various urban communities and poorer kids. But it's not just those kids who are affected by this. For example, girls would benefit just as much as boys from a curriculum that's more engaging, more interesting, and more flexible for teachers.
Right. So rather than changing kids, it's actually about making your curriculum and making your teaching style a little bit more flexible.
That's exactly right.
Sounds like there's some educating to be done.
I think so.
Joel, thanks very much for coming in.
My pleasure, Robyn. Thanks.
That's Joel Westheimer, our education columnist. He's also a professor in the University of Ottawa's Faculty of Education. Your thoughts on this, Ottawa Morning at cbc.ca, or you can tweet us at Ottawa Morning, just as Garth Boyd has just done, and says only the teachers who could not manage a classroom would tell us that we should medicate our son. Boys cannot be boys anymore, says